Community analysis. Tampa, Florida. Historic overview of Tampa. Tampa was founded in 1824 and is located in west central Florida. It is 27.95 in latitude and 82.46 in longitude, with an elevation of 41 meters above the sea level. The name Tampa comes from the Indian word Tampa, which means stick of fire. Tampa is divided into 6 geographic regions. They are as follows: New Tampa, West Tampa, Brooklyn Village, Downtown Ybor City, and Channelside. Structural analysis of Tampa. The community of Tampa has a very strong structure. When it comes to health care, we have major hospitals in the Bay Area that are equipped with a state-of-the-art machinery, which makes it possible to care for critical patients. The medical and nursing staff are also well prepared to care for delicate patients. Some of the issues that affect our community is lack of health insurance for all residents. Most elderly patients have Medicaid and they are able to use this great resource, but our younger working community many times struggles to obtain insurance coverage, mainly due to the high prices. To improve this issue, we as nurses can be a vehicle of communication to inform our patients of available medical care resources. Analysis of the population of the community. Population issues in the community of Tampa is found mostly in the younger males and females abusing prescription drugs. This problem has been growing significantly during the last decade. Compared to studies reported by the city of Tampa, my finding was similar: lack of education, high levels of stress, economic problems, and mostly low-income families. All these factors contribute to high incidence of prescription drug abuse. Health resources in Tampa. The Tampa Bay Area has health-related services that are very complete in quality and quantity, with 3 major hospitals, many walk-in clinics, low-income medical centers, and a vast amount of elderly care facilities. Some of the major hospitals include Tampa General, which is a Trauma 1 hospital, and it counts with a burn unit; Florida Hospital, Tampa, with a state-of-the-art cardiac unit; and St. Joseph's Hospital, located at the heart of Tampa, making it very accessible to the Tampa population. Analysis of adequacy of health-related resources and availability. Community objectives. Improve access to comprehensive quality health care services. The goal is to make health-related entities accessible to patients and their families. Use of health communication strategies and health information technology to improve population health outcomes and healthcare quality, and to achieve health equity with all the new technology available to the health and medical world. We can prevent mistakes and improve our turnaround patient care time. Promote health for all through a healthy environment, reaching all clients in a hard part, but with the increase of new graduate nurses, the health force has increased and improved the last few years. We can reach patients that we were not able to reach before. Community health resources. As nurses, we know that children and adults are the most vulnerable population. Our government has many agencies that provide help to those in need. In Tampa, we count with the support of the following agencies: Healthy Start, which helps unborn children and pregnant women to maintain their health through nutrition; Meals on Wheels, which assists elderly adults to have prepared meals to deliver to make sure they don't become malnourished. Primary prevention. Agencies that provide education, nutrition, and health assessment are considered primary prevention of disease. By working towards preventing disease, these agencies assist our government in saving secondary prevention. Health agencies in our community also provide secondary disease prevention by screening patients for any probable illness. Interventions focus on a specific problems, for example, drug abuse interventions, and referring patients to specialists, for example, patients with a specific illness or disease like diabetes. Tertiary prevention. In this case, the nurse has knowledge of the tools available for clients with problems like drug addiction, alcoholism, HIV, and many other issues that can interfere with patients' lives. The nurse will be the advocate, spreading the information about community resources available to the affected groups. The analysis of the environment in Tampa. Our community counts with organized companies that take care of on a daily basis of our environment, and it is successful in preventing new disease or the spread of existing ones. The office of the City of Tampa is in charge of most of the environmental services as sewer control, water supply, electricity, rodent removal, pest control. There are many private agencies that provide these services, but the City of Tampa is responsible for making sure these environmental issues are kept under regulations and that they follow the standards of our community. 6 overall community needs. The first one is preventative medicine. Patients, especially male patients, are not compliant with annual health examinations, vaccines, diet, and exercise. The second one is sexually transmitted diseases. Our community needs further education in the prevention of communicable diseases. Also, the treatment and maintenance of the disease is needed to prevent further spread. Number 3 is insurance coverage for the low-income class. People with low income are usually more susceptible to acquire diseases in the community due to the lack of hygiene, decreased intake of nutritional foods, and lack of medical insurance. Number 4 is transportation for the elderly. Many elderly patients end up back at the emergency rooms within 30 days of their last admission, and this is due to not being able to follow up properly with their primary care physicians. Most of the time, the reason is because they no longer drive and do not have anyone to take them to their appointments. Number 5, we have poor nutrition. Nutrition is a very basic but important need for patients of all ages. One of the community resources we can recommend to our elderly patients is Meals on Wheels. They will provide ready-to-eat meals to patients who are not able to prepare their foods. This will prevent malnutrition, anemia, as well as many other nutrition-related diseases. And number 6, the last community need, is domestic violence. This problem affects many women. We as nurses have the opportunity to provide information to the victims about the Crisis Center, which is a shelter that provides victims of abuse a place to stay, as well as counseling and assistance on getting back to the community safely. We also, in the Tampa Bay area, we have parks and recreational, we have a police department, we have the fire and rescue department, emergency care, disaster responses in case of a natural disaster, an organized election process. We have the Tampa officials, which includes the mayor of the city council, the members of the city council, the board of the commission. We also have the chain of legislation and responsibilities. We also have development of funding for the City of Tampa budget. And finally, the Tampa Bay area is a great city to live. We have great resources, and we as nurses are able to spread the word about these resources. Thank you.